Hello, everybody, and welcome to this month's vlogcast. I'm really delighted to have with me Jack Waldman. We met Jack when we were doing a forum up in Inverness at the beginning of September, and I was quite frankly blown away by his presentation on the psychological impacts of being diagnosed with a cancer and living with that anxiety. And he's very kindly agreed to share his presentation. And I say thank you again, Jack. And I'm going to hand over to you to share with the community the presentation we were lucky enough to see in Inverness.
Thanks, Nonna. Yeah, it's lovely to be here. My talk today is on the psychological impact of living with MPNs. And yeah, as it says there, my name's Jack, and I'm a clinical psychologist based at Maggie's Highlands in Inverness. So just to give a bit of an overview of what sort of themes will be covered today within this talk. So I'll start off talking about some common feelings and emotions which people can experience upon diagnosis, and then go in a little bit around change in function that can occur. And also, we'll talk a bit around relationships as well, and sort of communication with other people in your life, and how relationships can be affected. And then also a big sort of theme that we come across in our work is living with uncertainty, and we'll talk a little bit about that as well. And towards the end of the talk, we want to focus a bit on your own mental well-being and some of the support that is available for people. So just to initially talk here around some of the feelings that people can experience, and the slides here talk about some common things that people can experience, but I should say that everybody is different, so not everyone will experience the same emotions. It may be, as I talk through these, that you notice some of these apply to you and others might not, or it might be that it's completely different emotions. But I suppose this is just to give a bit of an overview of some of the common emotions that can occur. So the top there, I think it's important to acknowledge the sadness or grief that people can experience after the diagnosis. And I think this is related to the adjustment to the changes that a diagnosis brings. It might be that a person is grieving the way that their condition has changed, their day-to-day life, their body, their sense of purpose, their future. All of those things can contribute to that sense of loss. For others, it might be shock or denial. Initially, people might be caught off guard, and it might take a while to reach full acceptance of a diagnosis. Other people might experience frustration, and that again can be related to loss of things that were important to them. And with other people, it might be that numbness, and some people initially might not experience any feelings at all, and it might be that sort of sense of shutdown that can occur for a while. Other aspects there, self-image and self-esteem can be impacted. And for some people, it might be that they're worried about what others might think, or they might change how they experience the view of themselves. Anxiety and uncertainty can be quite a common feeling as well. And I think, a diagnosis of MPN can leave a person feeling unsure about the future of their health. And it's common to then feel anxious about treatment side effects or complications, or even things like, follow-up appointments can sort of heighten, that anxiety. Guilt is another feeling that does come up, and I hear that fairly often with people, and it might be that there's not anything sort of, rational that people are sort of guilty for. It might just be a feeling that can come up, and that can be related to, how their condition is affecting other ones or other people in their lives. And for some, there might be hope and determination, and many people can find resilience through treatment or support from other people. And just to talk a little bit here, this is related to the emotions, but when people are stressed or anxious, they can notice that there's sort of physical sensations in the body that can be related to that. So some examples there can include, muscle tension or shaking or quick heartbeat, difficulty sleeping, dizziness. All that can be associated with stress. And for some people, it might be that their behavior changes as well when they're stressed. So, it might be that there's changes in appetite, or they might find themselves becoming short-tempered or avoiding other people, or isolating themselves. All these things can be signs of stress as well. And just to move on here to talk a little bit about the change in function or loss of certain function that can occur with a diagnosis. And I think, quite a common one here is fatigue, and that can have a massive effect on day-to-day life. And that can be very frustrating, not being able to do things that you might have been able to do before. And it can be very difficult to adjust to this change in routine with maybe a reduced capacity compared to before. Memory and concentration as well. And I think, that relates to, lots of different things. It might be that people struggle to remember details, or have a struggle with sort of concentrating or remembering words, but it might be that they take longer to finish things. It can also be referred to as brain fog. And I think when people are noticing these cognitive difficulties, it can lead to, a loss of confidence or frustration, um, criticism, withdrawal, stress. All of these things can be impacted when your concentration is affected. And it can also in turn affect day-to-day things like employment or relationships. For some people, it might be that their motivation has changed following a diagnosis, and that can be impacted by energy levels as well, which is closely linked to routine. So I suppose it's just thinking about all these things that are impacted day to day by the change in function. Other things as well, I think, it's important to acknowledge discomfort or pain, because the unpleasant symptoms that people can experience, that might be medication side effects or bone pain or headaches. All of these can also have a knock-on impact on psychological well-being. I think it's important as well to touch on identity, and that covers lots of areas of life. So people living with MPNs might struggle to maintain work or family roles or their social life, given the symptoms and treatment side effects. So I think, acknowledging the career and relationship difficulties that can come up, which can certainly impact identity. For some people, they might notice that they're becoming increasingly withdrawn or isolated. And certainly living with MPN, some people might feel alone amongst others who don't share the same experiences. And people might notice that others don't necessarily fully understand what you're going through, and that at times can certainly be frustrating or invalidating. And just to talk a little bit more here around relationships, because it is such a big topic, and I think it certainly can be overlooked at times how much relationships are impacted by a diagnosis. So just noticing that living with MPNs can disrupt the dynamics of relationships with family or friends. And being diagnosed can change a person's role within their family or with their partner. And an example here is, prior to an MPN diagnosis, you might have been the one that looked after everyone else, but then following a diagnosis, it might be that you're the one that's receiving support. So certainly, those roles and dynamics can be affected. I think it's important to acknowledge that, a person and their loved ones might have many difficult feelings. And I think at times that might lead to strains or tension in relationships. It might be that there's difficulties with expectations as well. And like I mentioned, people might not fully understand what you've been through. or might have unrealistic expectations of your capacity, and that at times can be, quite frustrating. And also, for people diagnosed with MPNs, the diagnosis or treatment or side effects can impact sexual drive or intimacy as well, and I think that's important to acknowledge. So what we want to talk about here is, with that in mind, relationships being impacted, how can we, support with that or help? And I think encouraging communication is important when it comes to maintaining relationships. So certainly communication between you and your partner or loved ones can help you feel closer, and just having that space to talk about how you both feel can be helpful. For some people, talking can be quite difficult, so others might, write down their feelings and do that so that the other person can read, and that can just give a mutual understanding as well. And remembering, with communication, there's not an answer that's needed for everything. Even just listening to each other can be enough. And I think, maintaining honesty and affection can help when communicating, and even, acknowledging the positives. I think, going through an experience like a cancer diagnosis can also make relationships stronger. Big topic that does come up, and with people that we work with, is that sort of sense of uncertainty. And I think, with a diagnosis, especially with it arriving out of the blue, people can become much more aware of the uncertainty and lack of control that they have. And it is common for people to sort of worry and notice that their minds might wander to the what ifs. And in terms of managing that one way that we sometimes talk about is sort of, can we control these worries? So things like asking yourself when you're worried, can I do anything about this? And if the answer is yes, it indicates that this is a practical problem that can be solved. But if the answer is no, it may indicate that it's a hypothetical worry. And, the more that we engage with these worries, the harder they are to cope with. So what we ask people to do sometimes when they are worrying is sort of taking a step back and asking themselves, okay, what am I worried about? And asking themselves that crucial question, can I do anything about this? And that sometimes helps filter out some of those hypothetical worries that can't be solved, and almost encourages people to step back from them. And one of the ways that we, look at this sometimes with people is this sort of framework of the worry tree. And I guess this is just a sort of diagram format of what I was talking about there. And people that I've worked with, they might print this out and have it with them, and just almost use it as a tool when they find themselves worrying about things, especially if they're worrying about hypothetical situations. So again, it just sort of highlights at the top there, can I do something about this worry? And on the right-hand side, if it's yes, they might create a plan to sort of deal with it and solve it. But on the left there, if the answer is no, we want people to be encouraged to let those worries go and almost change their attention or do something else or distract themselves, because they've acknowledged that, okay, with these sorts of worries, there's not much we can do about them. So worrying only increases anxiety. So almost encouraging people to change that focus of attention. And even just acknowledging that there's nothing that can be done about that worry can take the power out of it a little bit. And there's many ways that people do sort of manage stress and worry and anxiety, but I suppose that's one particular strategy that may well be helpful. And just to talk a little bit more here around mental well-being, and I think it is very important, especially living with a diagnosis, to focus on your own self-care and managing stress or worry. And people tend to do that in lots of different ways, but I guess there's just some general lifestyle examples here that can be helpful for people. So we've spoken about, worries about things that you you can control, and maybe trying to filter out those ones that you can't control and maybe focus on the things that you can. Like we mentioned when we were talking about communication, you know, talking to loved ones can be helpful, or for other people, it might be talking to a professional. And you know, just talking to someone that you trust can help process and validate your feelings, and maybe help people come to a place, you know, of acceptance more. I think engaging in physical activity is important because that can increase, you know, energy levels and mood. And we know that, you know, people's sort of capacity is different. So remembering not to push yourself too hard, and even just a bit of gentle activity, such as a short walk, can be helpful. And again, just that focus on relaxation or reducing stress, making time for yourself, and also general lifestyle tips like eating well or getting enough sleep and rest. That can all be really important when it comes to managing your mental well-being. I think as well, if it's something that you haven't considered, you know, group support can be really helpful as well. And it might be that there's local support groups that are available to you. And I think that, you know, the benefits of peer support, you know, I think include things like just, you know, talking to people who are going through similar experiences, and maybe that sharing of ideas or experiences, struggles and hopes, that can just be really helpful to hear other people that are, you know, maybe going through something similar, to help you realize that you're not alone, and almost help build resilience within yourself. And within these support groups, you know, people can speak as much or as little as they like, but just that, you know, hearing other people and how they're coping can really benefit people that are going through a diagnosis. And for some, it might be that one-to-one psychological support is helpful, and I think that can help, you know, manage symptoms like low mood or anxiety, and can help improve coping skills. And one-to-one sessions offer a number of different things, so just even having a safe and confidential space where somebody can talk about their experiences. It might give people an opportunity to talk about concerns in a way that they haven't done before or haven't done with family and friends. Or even just, you know, having that space to be listened to and guided, and you know, maybe help you make changes in your life that might improve your well-being. And I'll maybe just sort of, at the end of this talk, just talk a little bit about Maggie's, where I work. And Maggie's is a charity that provides free cancer support across the UK. We've got a number of centres throughout the UK. And all the buildings are warm and welcoming spaces with you know, very experienced staff who can help people live well with cancer. And the environment gives people that space to discuss many complex issues that they're facing. And there's lots of different supports available. So there is a programme of support with different courses and different groups and interventions. And I've just kind of put some bullet points there of some that might apply to people living with MPNs. So for example, there's, you know, hematology network groups where people can sort of come together and receive that peer support. There's interventions for people before treatment and after treatment. There's relaxation classes and exercise classes. And there's also different workshops for specific symptoms like fatigue or stress or memory and concentration. And I think it's important to remember as well, it's, you know, that there's support for family and carers as well. So we do support anyone who is affected by a cancer diagnosis. And I think that sort of covers everything that I was hoping to speak about today, and hopefully that's given a bit of an overview of the impact that MPNs can have, particularly psychologically and you know, related to emotions and managing stress. So thank you very much for listening, and yeah, it's been a pleasure to talk about this today.
Thank you, Jack. Just a few things. I think that worry tree is one of the most useful things that people could carry in their pockets. I know sometimes anxiety can be overwhelming actually, and just to have something there's a tool that you can look at. I think that's amazing. And I just wanted to double check because we're talking about Scotland, and are all Maggie's centres UK wide able to offer the things that you offer in Inverness?
Yes, so each centre has their own programme of support, and there are core courses and workshops that are available at each of those centres, and anyone can just drop into any of the centres across the UK, and you don't even need to book an appointment. You can just walk in the door, and then that support will be there, and you can speak to someone. So just knowing that support is available across the UK.
That's amazing. And of course, we at MPN Voice have a buddy system where if you really want to have some help and talk to somebody who has got an MPN, and they have to have been diagnosed for 2 years, and we actually also have a process where to become a buddy you have to fill in forms, so that we deliver best practice on that. But I know so many people who have been helped by having a buddy. And I think sometimes, when somebody is newly diagnosed, it's really difficult to take it all in one go. And the worst bit is that you've got an incurable cancer.
Yeah.
For the moment. I mean, there are lots of treatments coming on, but we have to hope they one day find a cure. But I agree with you. I think, the difficulty for a lot of people is actually asking for help.
Yeah, yeah. I think that can be a real struggle at times, and we often hear that people just making that first step and coming in the door can take a lot of courage and encouragement as well. So just knowing that support's available can be really helpful, and trying to reduce that stigma around receiving support, because there is so much to deal with and it can be really overwhelming. So please do reach out for support. That's what we would encourage.
But I think what I really liked also that you said in your talk was that there is help for families too, because I never underestimate the impact on a family, or when there is a diagnosis. As a patient, one gets into the system, and there's all the medical thing, the tests and everything, and are all done. And sometimes I think the families are kind of left on the side with um, all sorts of thoughts and feelings and fears. And I was delighted to hear that the doors are open for families as well, because I think that's really important.
Yeah, of course. And I think when you were talking there about, people reaching out for support, sometimes we hear family members thinking that, oh, well, I don't need support. I'm not the one that's going through it. But, for sure they're experiencing a lot of overwhelm and stress at times as well. And it can impact everybody in someone's support system. So just knowing that families and carers have that support too, available to them.
It's really good. Well, thank you so much for sharing this, and I'm sure it will give reassurance to a lot of patients, and knowing too that they can access Maggie's centres around the UK, just walking in the door. It's a great resource for patients, MPN patients, to have. Thank you very much, and
No problem at all.
hopefully we will meet again in Inverness in a couple of years' time.
Thank you very much for having me.
Yeah.